name is Dr. Joshua Taylor. I'm a general surgeon. I'd like to thank you for coming to see me today in consultation. I'd like to use this time using this video to explain the reason you're here to see me and answer some questions so that when you and I sit down, we can have a more in-depth conversation about what it is that is exactly going on with you or any questions or concerns that you might have. Diverticulitis is an inflammation of the colon associated with something known as diverticulosis. Diverticulosis are little outpouches of the colon that can develop over time. The most common reason that we have found people develop diverticulosis is eating a diet that is low in fiber or high in processed foods, dealing with issues such as constipation or irritable bowel. The outpouchings can become blocked, and that can allow the bacteria that are naturally within the colon to live in an area where they are away from the body's normal immune system and begin to create inflammation and oftentimes an infection. And so the most common treatment for diverticulitis is being placed on antibiotics. When you've had multiple episodes of diverticulitis, or you've had what's known as complicated diverticulitis. And that's when one of those areas ruptures or perforates, or you've developed an abscess. And so sometimes you may need extended course of antibiotics, a drainage tube, or even emergent surgery in those situations. If you've been able to get through one of those episodes without requiring surgery, then we would want to talk about how to prevent this from occurring again, and that's where surgery comes in. The role of surgery is to remove the area of your colon that's been affected by the diverticulitis. Most commonly, that's in an area called the sigmoid colon, but you can develop diverticulitis in any area of the colon. And so removal of that area will help prevent you from having recurrent episodes. The most common way that I perform diverticulitis surgery is minimally invasively, and that's either laparoscopic or robotic. It's multiple small incisions, and then usually an incision that's 3 to 4 inches for us to remove the area of your colon that we resected. Oftentimes this surgery takes between 2.5 to 3 hours, and you're usually in the hospital for 2 to 3 days after the surgery. The goal of the surgery is to remove the area where you've had prior diverticulitis and get things hooked back together in their natural configuration. Now, one of the most common questions we get asked is, am I going to end up with what's known as a bag? We call that either a colostomy or an ileostomy. The most important thing to understand is my goal is to never have you end up with a bag, but sometimes that is a necessary step in this process. And we will talk more in depth about your particular situation and why we potentially would need to do that. So what are the risks of diverticulitis surgery? Well, anytime that we operate on the intestine, infection is a big risk that we think about. So oftentimes before the surgery, we will have you do a bowel cleanse. That often means taking a drink to clean your bowels out, as well as an antibiotic to decrease the amount of bacteria in your intestine to cut down on the risk of infection. The bowel has a very good blood supply, and so bleeding is also a risk of the surgery. Thankfully, when we do the surgery, we oftentimes are able to evaluate the blood vessels and make sure that there's no ongoing issues with bleeding. Anytime that we take and remove a part of the intestine and put that back together, that's called an anastomosis. And for a variety of reasons, those anastomoses may not heal. And so you can have something called a leak. And so if that leaks, that can make you sick, and you would potentially need antibiotics, further surgery to repair or fix that problem. When we perform the surgery, we have to be very mindful of the other intestine, as well as other organs that are close to the area where we're performing the surgery. Most commonly for diverticulitis surgery, that's oftentimes the bladder, ureter, and kidney that are all connected. And so we have to be very careful to protect those and not damage them during the surgery. I'll be in momentarily to talk with you and be more specific about what it is that's going on with you and how I think surgery might help. If you have any questions, feel free to write them down. You can re-watch this video and you and I will go through them when we meet.